Hello, my name is Dominic Mack. I'm the Executive Medical Director of the Georgia HIT Regional Extension Center. We're one of 62 regional extension centers across this nation. Our mission is to help providers to adopt electronic health records within their practices. Within this mission, we're also working with the Department of Community Health, who's responsible for establishing the Health Information Exchange. So it's fairly simple. It's not easy to do, but what we are the foot soldiers to help practices and hospitals to adopt the technology of the electronic health record. And then the state, we help the state, but the state builds the Health Information Exchange so all these electronic health records can communicate with each other, share information, so the providers can use best practices through the technology using such things as clinical decision support. And then you can see where you can improve clinical outcomes within these practices. As I stated, there are 62 extension centers across the nation who are doing similar work within those states. Some states have one extension center, as the state of Georgia, but many states have multiple extension centers. You can see by putting electronic health records in practices and hospitals across this nation, allowing patient access to this information. Of course, doing this in a private and a secure manner can lead to a point where you can actually survey the population and look how certain medications or certain best practices are really actually doing within these practices. So in real time, you get patient information and you can change the way you practice medicine, because you can actually see what's going on when it comes to public health, when it comes to infectious diseases, and when it comes to certain chronic diseases such as hypertension, diabetes, etc. So with this population surveillance, we move toward improving the best practices, and then we move toward improving population health. The patient-centered medical home, accountable care organizations are new models that help with quality, but they're also new payment models. And the way providers will be paid is going to be different, based on not fee-for-service, but based on pay for performance. So we believe the technology, the health information technology, is the cornerstone of these new models. There's no way we could do this on paper records. So this is a slow train and sometimes a fast train that's really coming. With the incentives and with Medicaid and Medicare, disincentives are coming quickly for providers. The private insurers are currently getting involved in this, and they have payment models that basically incentivize the providers in the hospitals to improve the quality of care through the adoption of electronic health records. So it's something that all providers and practices have to get on board with in some form or fashion, but we want to do this in an equitable manner so everybody is allowed the opportunity to adopt, not just those who are better prepared and better financially in a better situation, but also those who are in rural communities, underserved communities. How do we get the technology in their hands? And that's what we're here for, to try to make sure for that. So make sure you go to our website, take a look at what we do, get involved with what we do. And if you need help with the adoption and we can be of help to you, we definitely want you to get in touch with us. So thank you for listening in today.